Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their healthcare needs. I do this via my COVID-19 testing, primary care, telemedicine, as well as through my brand new best-selling book, Vitality. So, good afternoon, ladies and gentlemen, and welcome to Let's Chat. We're continuing our conversation about heart matters. We know that February is Heart Awareness Month, so we've been trying to highlight those things that are important for us for heart health. And one of those topics, one of my topics that I love talking about is blood pressure. So we're talking about one of those things that's very easily influenced by your blood pressure, and that would be stroke. Okay, so we had stroke part 1, so now we're having stroke part 2. So let's talk a little bit at first, like, why are we talking about stroke? Why is it so important? Let's talk about some statistics. Every 40 seconds, someone in the United States has a stroke. Each year, over 140,000 Americans die as a result of stroke. African Americans are actually almost 2 times the risk of our white or Caucasian counterparts to have a first stroke. So it's higher risk in African American people. Your stroke risk also increases with age. So as we get older, we have a higher increased risk of stroke. Men are more likely to have a stroke than women, although there's some numbers and some research that is showing recently that younger women that are having stroke are more likely than men. So in general and overall, men are more likely to have a stroke than women, but we are seeing some alarming increase in numbers and numbers of people that are young that are having stroke. So this is why we are having the conversation. So there are 2 types of strokes primarily that people have. One is called an ischemic stroke. One is called a hemorrhagic stroke. The ischemic stroke is more common, typically about 87%. And that's a kind of stroke that occurs because of a block in the blood vessel of the brain. We kind of reviewed this last time with step 1, with talking about stroke with part 1. So I'm not going to review that a whole lot in detail here. If you have a hemorrhagic stroke, that's the second type. That's typically more common with blood pressure issues. That happens because that blood vessel either leaks blood or the blood vessel ruptures, and you have what's called a hemorrhagic stroke. You can also have what's called a mini stroke, which is a stroke that occurs over a shorter period of time. Typically, the patient may experience symptoms for less than 5 minutes, and they may recover to normal. But the reason why we care about those, remember we talked about this already, is that if a TIA or a mini stroke, we called it a mini stroke or a TIA, transient ischemic attack, if that attack or that stroke goes untreated, you put yourself at largely increased risk for having a stroke within the next calendar year if it goes untreated. So we want to make sure we pay attention to it. So let's talk about some of the warning signs of stroke, okay? We're going to go over some risk factors. We're going to go over some more statistics for you to see where do we in the state of Alabama line up with other states in terms of talking about suffering from death as a result of stroke. We're going to talk about that in a minute. But first, let's talk about some of the warning signs of stroke. If you are out somewhere, and this happens very commonly, guys, where you can be out somewhere sitting next to someone, especially in an area like church or things like that. And I know that we're trying to remain socially distant, and we definitely need to go on to continue to do that. But you can be out and see symptoms of something going on, and we want to make sure that if you're out and you see this, that you know what to do or to share this information with other people. So 5 warning signs of stroke include sudden onset of weakness or numbness on one side of the body. So you can have weakness or numbness on one side of the body. That's a warning sign of stroke. Number 2 is sudden speech difficulty or confusion. So if all of a sudden speech changes, confused, that can be a warning sign of stroke. Second warning sign. Third warning sign of stroke, difficulty seeing in one or both of your eyes, okay? That is also a warning sign of stroke. Number 4, sudden onset of dizziness or trouble walking or loss of balance. So that oftentimes you hear stories sometimes about people having a stroke, and they can have family in the next room, and all of a sudden, they walk in and their relative or the person they're in the home with is laying over on the bed as if they've fallen over, as if they can't use one side of their body. That's what we mean when we talk about that, trouble walking or balance. Fifthly, sudden onset of a severe headache without any explanation. Okay? So there's an acronym that is used by the National Stroke Association as well as the American Heart Association that can actually be used to save a life from stroke. By learning this acronym and sharing it with other people, which is part of the reason why we had an entire episode specifically for this today, to try and give you something to hold on to that you can take and use out in the community or to help your family. So learning this will be very helpful if you're in a situation where you're presented with someone that's having stroke symptoms. So the acronym is FAST. That's F-A-S-T. So the F is for facial droop. Does one side of the face droop or is it numb? So does one side of the face droop or is one side of the face numb? You want to ask the person to smile. If they smile and one side is uneven or lopsided, then that's a sign that that particular person could be having a stroke. These are also symptoms that you'll sometimes see in a patient that is dealing with a challenge of Bell's palsy. But the main thing there is that if you're like, we think it's Bell's palsy, we think it's not, it's very important to go ahead and act, and we'll get to that in just a moment. So facial droop, that's what the F means. A is for arm weakness. So is one arm or the other weak or numb? So numbness or weakness in one arm or the other is what the A stands for, arm weakness. Ask the person to raise both their arms. Now, does one arm drift down, kinda? When you have them raise their arm up and they kind of can't lift it all the way up with a contralateral arm? If that is the case, that could be a sign that that individual is having a stroke. So we want to make sure that we pay attention to that. S is for speech. Is the speech slurred? Now, some people will say, they already have a little bit of a speech impediment. They have a little bit of a lisp. It's hard for me to tell. What you're looking for is this person's speech different than it typically is? Is the speech different? Is the person unable to speak or hard to understand? Ask them to repeat a simple sentence. When we see patients in the ER, or in urgent care, I'm not an ER physician. I board certified family medicine, do urgent care. But we send them to the ER when we're suspecting that they have a stroke. So sorry about that. But when we see them in clinic, one of the things that we very quickly will ask them, and that's something that if we have a patient that ever presents to us or that we see, we usually will assess that patient very quickly because time is of the essence and we're moving to that next. So for speech, you want to ask them to repeat a simple sentence. We typically ask them to repeat no if, ands, or buts. So repeat it, no if, ands, or buts. If they cannot repeat that or a simple sentence like the sun is shining outside and it's different, then that is a sign that you may need to call 911. And that brings us to the T, time to call 911. If someone has any or all of these symptoms, please call 911 right away. Time is of the essence. Even if, and I want to make this point here, even if the symptoms go away, we still want to call 911 because that patient could be someone that's having a stroke that is what we call evolving. Those symptoms can also be what we call oscillating or going up and down. So that's not something we can determine on an outpatient basis. We need you to get to the emergency room, need you to get there right away so you can get that scan and determine. It's very important, the time factor in getting that person to the emergency room right away because there are life-saving medicines that we can start within the first 3 hours of someone having a stroke, 3 to 4 hours of them having a stroke. Okay, so we want to make sure if you're having these symptoms, do not go to, you can call your regular physician's office, right? And I'm sure most likely they're going to tell you if you think you're having a stroke to go to the emergency room because they have the ability to be able to institute or start medications that can be life-saving for that individual. And it makes a difference whether or not that patient had residual signs or symptoms, or it could even save their life. So let's move on to talking about, I saw an article that talked about what are the 10 states that are highest in stroke deaths, okay? Because deaths from stroke are higher in the southeastern part of the United States, in the southern states. And inevitably, guys, that's probably related to our diet. We're going to talk about some risk factors in just a moment as we close this out. But it was astonishing to me. So how do we line up in that, right? So number one state with the worst deaths in the country is Mississippi, with a stroke death rate of 51.6%. That means 51.6% of people have a stroke die. That's Mississippi. Alabama is number 2. Guys, we are number 2. This is not the list that we want to be at the top of, right? Right. We don't want to be at the top of that list for stroke death, but it's 50% in the state of Alabama. And we are followed up by Louisiana. Also included in that number in the top 10 includes our neighboring states, South Carolina, Arkansas, Georgia, as well as Delaware, I know was a state that was mentioned as well. So we are not doing well here. So what can we do about it? What can we do? What can we do? What can we do? So let's talk about the risk factors really quickly. We review these. A lot of these risk factors are still the same risk factors for having a heart attack as stroke. So I always will talk about that when I'm talking about with my patients about things that put you at risk for heart attack or stroke. So risk factors include high blood pressure, number 1 risk factor. Having a history of heart disease, having had a heart attack in the past, being diabetic, having sleep apnea, having any kind of valvular or heart disease, okay, puts you at an increased risk for having a stroke. In addition to that, viruses and alcohol abuse can also put you at increased risk for heart issues. Now, in addition to this, tobacco use and obesity are also risk factors for having a stroke. So we want to make sure that we pay attention to these things. So let's review again that FAST acronym. You guys want to learn this, teach this to your family. If this information is helpful for you, please share this video. Feel free to tag someone in it. And again, that acronym used by the National Stroke Association and by American Heart Association is FAST. And that's FAST for F is for facial droop. Does one side of the face droop? Is it numb? You ask a person to smile. If the smile appears lopsided, their smile should appear. You see the cheeks raised on both sides? If it is lopsided or uneven, that is a sign that that person could be having a stroke, okay? So F is for facial droop. A is for arm weakness. Is the arm weak or numb? Can that person raise both of their arms? If one side drips down, that's a sign they could be having a stroke. Number 3, S is for speech. Is the speech slurred? Is it garbled? Does it make sense? Is the person unable to speak? Is it hard to understand? Ask them to repeat a simple sentence. And then T, time to call 911. If they have any of those symptoms or all of them, call 911 to help save a life as a result of stroke. So, do we have any questions? That's all I had to share today with you guys. Thank you for tuning in. For those of you that have been following us with this Heart Matters series, I hope it's been helpful for you. If you have other topics related to heart disease or what have you, please feel free to inbox me with that or any other topics that you guys might find interesting. I do want to take a moment here. I did share on my personal social media that I had had my second dose of my COVID-19 vaccine on Friday, had it at about 3:45, 4 p.m. So just want to share there. Today is Sunday, so that was Friday, 3 or 4 p.m. Went home that day, and this was my second dose. Now, my first dose was pretty benign. I had a little arm soreness like for a day or so. Nothing really big. May have felt a little tired, a little bit of a headache. I had some chills, though, not the first night, but the second night of my first dose, right? So with this dose, Friday when I came home, had a lot of localized inflammation pain. Woke up Saturday, my arm hurt like the dickens. My husband hugged me, and I just immediately jumped back, which is not something I do when he hugs me, right? But it hurt. It was that level of pain. So the pain got up to about a 6 or 7 out of 10 on yesterday. I was extremely tired, stayed in the bed most of the day. That's not like me. Even when I'm tired, I tend to get up, move around, do things. Didn't feel like doing much of anything yesterday. Had to fight to stay up, trying to get work done. And then today I woke up feeling a little bit better, not as tired, still a little bit tired. Went to the gym and was able to do a 2-mile run on the curve, which is about normal for me. I usually do 2 to 3, but I wasn't able to push myself to do more upper body or weightlifting, things of that nature. So other than that, I feel okay. Feel very happy to be vaccinated and doing my part in the attempts to reach herd immunity in our community. But other than that, have no issue. Does anyone have any questions about that or about stroke at this time? We will be talking about the vaccine more in the next coming weeks. We definitely will be talking about it even on tomorrow. So any questions? Any questions? So remember our FAST acronym, and what we want to do is move Alabama. We don't want to be number 2 on this list. We don't want to be in the top 10 on this list, guys. We definitely do not. But that FAST acronym, facial droop, arm weakness, speech, and time to call 911. Please make sure that you take care of it and remember that. Hope everyone has a happy Sunday. We are continuing to provide COVID-19 testing at Legion Field, serving those uninsured and insured population. Happy to do that. If you're in need of testing, please give us a call at 205-543-2684. We'll make the appointment for you, or you can visit our website at drceleste.c19.com. That's drceleste.c19.com. Thank you so much for tuning in, everyone. Hi, Miss Golson. That's my sister Kim from Chicago. Hey, Kim. Hope you guys are staying well up there. That's my husband. Hey, babe. Thanks for tuning in. And Miss Kyles. Hey, Benet. My friend from Montgomery. We grew up together. Thank you for tuning in. And Trevino, Marshall. Hey, we graduated together. How are you? Hi, Miss Black. How are you? Thank you guys for tuning in. If this is helpful for you, please share with other people. I encourage you to get the answers. If whether or not you want your shot, don't want your shot, don't waste your shot. Get the answers to the questions you have about the vaccine now, so in the short term that you don't waste your shot. That's all we have for you guys today. Have a good day. Happy Sunday.